Welcome! Today we are going to have a look at the anterior crossbite case. Let us have a look at the virtual setup. The upper arch, as you can see, is deformed and is not symmetrical in shape. At the same time, when we switch to the lower arch, we can notice that we have spacings here, like tremors and the diastema. This situation might seem rather difficult for aligners. At the same time, it was the case when a patient was ready only for aesthetic kind of treatment, that is, when the devices are not visible. Now we are going to have a look at the movements as performed by the Exceed laboratory. Another look from the left side. And from the right side, so we can see how the crossbite is being corrected. Now let us analyze the movements looking on the upper and on the lower arch. If we look on the upper arch, we can see how the shape is being corrected and the teeth are aligned. Now, if you look at the lower arch, you can see how the laboratory made use of the spacings to align the teeth while moving them in. Now we are going to have a look at the attachments. The triangular attachments on the molars and premolar are used for anchorage control and beta fixation. The vertical attachments are used to control angulation, and the horizontal ones on the incisors are used for extrusion. You can see this movement here. Now, the horizontal lines on the lower incisors are not attachments, but concavities in the aligners themselves. They are used for a better bodily control of these teeth. Now let us analyze the movements performed on both arches. As you can see, most of the movement on the lower arch was performed in the frontal region, and if you follow the movements on the upper arch, you can see the same picture. It was possible because we had the situation with spacings, tremors and the diastema on the lowers. Alternatively, we could have added more widening in the premolar region or using IPR. Now, if we follow the steps and the time of the treatment, we can see that it was 11 aligners for the upper arch and 12 aligners for the lower. That is about 10 months of treatment. The initial idea was to align the teeth, and the result was achieved.